Hello, everyone. My name is Dr. Crowder, and I'm a senior consultant for Capital Health Partners. I have been doing COVID-19 webinars for the general community and got asked to do COVID-19 webinars for the business community. It is April 23rd, and we are starting these to actually go over what does a work smart plan actually look like for small, medium, and large businesses. I'm a senior consultant with Capital Health Partners, my website that I've been doing everything to the community is AskDrV.us. My business website is capitalhealthpartners.com. All of my information on all the slides will be in the lower right-hand corner. In addition, a lot of people are asking for some of the original source documents, and the original source documents will be on AskDrV.us, and those are the research documents that actually support some of the data that you will see in this presentation. All right. So a little bit about myself. I'm a board certified emergency medicine physician, and I also have my MBA from Wharton. I've sort of worked in both business and the medical community now for the last 30 years. I've actually navigated 4 pandemics. COVID-19 is the 4th. Also HIV, tuberculosis, malaria, 1 mass shooting, and a Category 5 hurricane. And with all of these, I've actually worked to really bring a unique blend of healthcare, public health, and business acumen to the forefront to help people weather times of uncertainty. So let's talk about the building blocks for a COVID-19 work plan, because it includes medical science, trust, and teamwork. And I'm going to actually go over each of these. We're going to start first with medical science. And I think this is very important because there's a lot that people actually hear on the news, but that's very superficial information. And the information that I'm going to provide for you today will be much more detailed than you've ever heard about COVID-19. So first of all, how is COVID-19 spread? It's primarily people and surfaces. So people through small droplets of their nose and mouth when someone either coughs or exhales or speaks. Those droplets then land on surfaces that people touch or maybe inhale. And if they touch those surfaces with their hands, then they infect their eyes, nose, and mouth area. So I tell people it's important to respect COVID-19 because it's highly contagious. So when we talk about how contagious is a particular disease, that's calculated in 2 ways. 1, what is the minimum time of exposure that's needed to infect somebody else? So with COVID-19, that's 45 seconds of exposure is actually all that's needed to infect someone. Then the other thing we look at is what is the percent penetration or the percent transmission. So basically, if you had 100 people that were exposed to COVID-19, how many of them would actually come down with the disease? So for COVID-19, that's 60 to 80%. When you look at something like influenza A or influenza B, it's 20 to 30%. So COVID-19 is a highly, highly contagious disease. Other reasons why I tell people to respect COVID-19 is it's a droplet disease. It stays on surfaces for a very long time. It depends upon how porous the surface is. So for instance, it'll stay on cardboard surfaces for 24 plus hours. Plastic surfaces, 96 plus hours. When you look at metal surfaces, it could stay on a metal surface for a week. So COVID-19 on surfaces, it really stays on those particular surfaces in a clinically significant way for a very long time. So workplaces need to significantly reformulate their processes. I don't want anyone on this call to think that, oh, I can just, install a couple of sink basins and tell people to wash their hands and maybe give out some sanitizer. That will not protect your workforce against COVID-19. So particularly assignments or workplaces where employees are in close quarters need to really reformulate their processes. That's correctional employees, military services, rehab, nursing homes. Any manufacturing plant, particularly if you're dealing with metal or hard plastic surfaces, because those metal and hard plastic surfaces are surfaces where COVID-19 stays on those surfaces for multiple days. Also, any businesses that would normally be public facing. So if you're thinking about restaurants, nail salons, hair salons, massage parlors, that sort of thing. It's important that people understand in a business setting what are the symptoms, because there's been a lot of talk about the respiratory symptoms associated with COVID-19, but there's actually many, many more symptoms than that. So the number one symptom is no symptom. When you actually look at COVID-19, there is a high percentage of people that are COVID-19 positive that have zero symptoms. So if you look at the Theodore Roosevelt, that was about 60% of their COVID-19 positives had no symptoms. If you look at Cook County Jail, they did something, it was about 45 to 50%. Iceland did a study, it was also 50%. So no symptoms can actually transmit COVID-19. The other thing that is a very early symptom is sudden loss of taste or smell. Sometimes patients don't actually recognize it as sudden loss of taste or smell. They just say, I don't have an appetite. So it may be a loss of appetite and not eating. GI symptoms, nausea, vomiting, and diarrhea are symptoms of COVID-19. There is a fecal oral route to the transmission of this disease, which leads to nausea, vomiting, and diarrhea. The other thing is hypercoagulability. People actually present with COVID-19 with clots in their lungs, clots in their legs, and they can also present with strokes or confusion or memory losses. Then you have the normal symptoms that we normally talk about, which is respiratory symptoms: headache, fever, achiness, dry cough, difficulty breathing, coughing, the normal things that you actually talk about, that they talk about on the news. And the other things are what we call COVID toes. This is actually a dermatologic outcome, and it's primarily in children, but you can also see it in adults. And it's a reddish, bluish discoloration of the toes. Parents are sometimes bringing their kids in, or their young adults, children in, and wondering what this is. These children need to be quarantined for 14 days and presumed to have COVID-19. So, as I talked about the asymptomatic transmission, which is very, very important, these are just a couple of articles that actually talked about it in Theodore Roosevelt, Iceland, Cook County Jail, and also in Rome, Italy, which is the other place that saw asymptomatic transmission. Now, let's talk a little bit about the risk factors. So the risk factors are anyone that is born on or before 1955. Now, ordinarily, they talk about it as far as the elderly. I don't use the elderly because most people don't think of themselves as elderly. It's born on or before 1955. So it doesn't matter if you go to the gym every day, you run marathons, you feel like you're in good shape. If you are born on or before 1955, you have a risk factor for COVID-19. The other risk factor is people who live in a nursing home or long-term facility, anyone with COPD or chronic lung disease, moderate or severe asthma, anybody with heart disease or complications, maybe stents, bypass, valvular disease, anyone who's immunocompromised, which would include HIV, cancer, rheumatoid arthritis, sarcoid, lupus, any of the autoimmune diseases. Any particular underlying disease is not well controlled: diabetes, renal failure, liver disease. In general, pregnant women are more susceptible to viral illness and also need to be really considered in this, but the CDC has not formally made them a risk factor. The other thing, which is not talked about, which is important, is that severe obesity is a significant risk factor. And this is at any age. So anyone with a BMI greater than or equal to 40 at any age has a risk factor. So let me just talk a little bit about what that is. 5'2" and over 220 pounds, 5'6" over 250 pounds, 5'10" over 280 pounds, and 6 feet over 300 pounds. So you can see it would be quite easy to sort of be, let's say somebody who had bypass surgery, you're 66 years old, and you're overweight, right? You suddenly have 3 risk factors, and you could actually lead a very healthy lifestyle that you feel like you do. So other important risk factors: men are more likely to actually get the infection, and they also have a higher death rate. I actually put the percentages there. The other thing that they found is around the blood type. People with blood type A seem to be more vulnerable to COVID-19, and people with blood type O seem to be a lower risk for infection and don't seem to do as poorly. The other thing is smoking and vaping is a very, very big risk factor. 40% of the hospitalized patients are between 20 and 54 years old, and we believe this is primarily a result of smoking and vaping. So we're recommending that anyone actually quit smoking and e-cigarettes at this point in time. The respiratory problems associated with smoking and vaping lead to very severe symptoms. And currently in the United States, we have 2 million high school and middle school students who actually use e-cigarettes. So let's talk about trust. When you actually are working with your employees, it's very important that you actually go over the basics, because you don't know who knows what. So one of the basics is proper hand washing. There's been a lot of talk about hand washing, but very little talk about proper hand washing. There are 8 steps associated with proper hand washing. I tell people, they find it to be kind of funny, but we spend almost a month on how to properly wash your hands in medical school, right? So if you look at step 1, palm to palm hand washing, that is normally what most people do and they stop. Proper hand washing also includes step 2, which is in between the fingers, step 3, which is the back of the hands, step 4, which is the base of the thumbs, step 5, which is the back of the fingers, step 6, which is the fingernails, step 7, washing your hands, includes your wrist, and step 8, which is rinsing and drying your hands, because wet hands actually pick up a lot of things. So you want to make sure to get your hands completely dry. Now, let me show you what happens when you actually don't do that. So this is slide number 1 is before washing, okay? Slide number 2 shows what happens if you just rinse your hands and shake them. Slide 3 actually shows 6 seconds of washing with no soap. Still, not much has actually occurred. Slide 4 shows 6 seconds of washing your hands with soap. Slide 5 shows 15 seconds with soap. And slide 6 shows 30 seconds of properly washing your hands with soap. You'll notice the knuckles, etc., and the thumbs and the little finger are all properly washed. There's been a lot of talk about social distancing, and I know that social distancing can be difficult in some work settings. And I wanted to show the impact of social distancing. Prior to the lockdowns and what we were doing, the regular way we were leading our lives, one person would infect 406 people in 30 days with COVID-19. With 50% less exposure, one person infects 15 people, and with 75% less exposure, one person infects 2.5 people. This is very important when we start talking about what the work setting looks like and how to set up the work setting in a way where we actually have some degree of social distancing, particularly in areas that might have crowded people, either correctional settings, nursing home, rehabs, or manufacturing settings. Now, I get a lot of questions about what is PPE. PPE is personal protective equipment. It is basically gloves, shields, goggles, Tyvek suit, shoe coverings, and also some sort of mask. I don't actually recommend disposable mask for most settings that require PPE. We can go over that a little bit later. But the degree of PPE that's actually needed really will depend upon the business setting and what you're actually doing in that business setting. I will say this, is that the less you're able to social distance, the more important PPE is. So in the emergency department, we're not able to social distance from each other because we may be working on a patient or doing a resuscitation, and PPE becomes particularly important when you're in settings where you're unable to social distance because of the job. A little bit about the steps and the safe and effective use of disinfectants. On my website, I actually have the information on the disinfectants that kill COVID-19 and how long they take to kill COVID-19. It's very important that you actually follow those contact times if you're going to use disinfectants and actually clean surfaces using those disinfectant times, and wear gloves and wash your hands as you do it. So let's talk about teamwork. It's really important in this sort of setting for management and employees to really work together and to create things that actually work for their particular work environment. So one, I want to talk about risk stratification. So one, different jobs have different risk, right? And it's very important that jobs be categorized by their particular risk factors. In some situations, you may be able to modify a job such that it has less risk. So for instance, my job could be to do the temperature screening of all the employees before they come into the work setting. The job could set up a way for me to do that in a touchless manner, which would decrease the risk stratification of the job. But I think it's very important. We use at Capital Health Partners, we have 5 categorizations for risk stratification of jobs based upon what that person is doing and what their interaction is. Then you have to categorize individuals and actually look at their risk factors, right? So when you're an employer, there's 2 things that you know for sure. You know the person's date of birth, and you also know if they're obese because you see them come in every day. So those 2 risk factors you know without them actually providing you any additional information. We actually allow employees to voluntarily provide additional information. If they don't want to, they don't have to, but they can voluntarily provide information about other risk factors that they may have for COVID-19, and also a little bit about their home life, as far as who is at home with them, because carrying the disease back to your home is also a component of this that you have to factor in. It's very important that you align job assignments with risk stratification such that you have people, you don't have someone who's at high risk for COVID at a high risk job, right? You want to have someone who's at high risk for COVID and not doing well at a low risk job. So risk stratification is a very important component of what we actually advise businesses to do, and actually do that upfront and have the conversation. And again, at the end of the day, we're not able to eliminate stress, any sort of risk. This is all about risk mitigation. So let me talk, people ask me, well, what sort of things should employers do? I'm gonna actually give you the top 5 things that I think employers should do. There's a lot more to do, but I just wanna give the top 5. Post signs and symptoms of COVID-19, because most people don't realize that there are GI symptoms and dermatologic symptoms and also blood clotting. Post the risk factors for COVID-19. Many people don't realize that they have more than one risk factor. Temperature check all employees. This is very, very important. Seek employee input and create forums for them to ask questions. As employees come back to work, they have questions about this or that. And again, it's not that we have an exact answer, but it allows them to actually say, okay, what would be better for me to do, this or that, given how this disease works. then it's important to create a smart work plan that you then update every 30 days. So let me actually just give a couple of examples. If you're a public-facing business or an office setting, the plan should at least, at a minimum, include 10 to 15 changes that you're making to your actual workplace. These changes are not always expensive. In fact, sometimes it could lead to something that is even cheaper than what you're already doing. And if you're in a manufacturing plant or some sort of workplace where there's closed quarters, then you should have 20 to 25 changes that you make as a part of your smart work plan. So the 5 that you gave you are for either one of these environments. And then anything that you do then is over and above that and is specifically geared and catered to your specific work environment. So let's talk about what we do. We have a diverse medical team that provides direct COVID clinical care and fields questions from employers and employees on COVID-19 questions. I get tons and tons of questions, everything from what about my dog, to should I get my hair done, to should I go into this particular environment or that particular environment, should I travel, should I go on a plane. We also review COVID-19 workplace plans. Some businesses actually have a plan that they've already sort of put together, and they want to know, did we do enough? Or is there some simple things that we could actually add to this? So we actually review an already existing COVID-19 workplace plan. And the other thing is that we actually conduct a risk assessment, and this goes into actually, everything around the risk stratification of the jobs, the risk stratification of the employees, and actually looking how to align your workers with the job that is most appropriate for them. Lastly, we provide all the medical legal expert opinion for the U.S. Virgin Islands. So we also interface with legal offices that actually want to know, what sort of things do we need to do to mitigate our medical legal risk around this. So those are sort of all the things that we do. You can feel free to reach out to us on any one of these platforms. And I tell people, this is really not about, are we going to be healthy or are we going to go to work? This is about how to be healthy and go to work. This is about how to do it. We can mitigate risk in these environments, being responsible, such that we can all figure out a way to actually continue some degree of work and productivity until a vaccine comes around. All righty, so I'm going to now open it up to Q&A for those of you who are not a part of our Q&A and you're just here for the presentation. I want to thank you for joining us today. This is all of my contact information, and I look forward to what questions you have. Thank you.